Hello everyone for another Plab 2 station with Dr. Al. I'm gonna give you the discussion that we have every day with the patients, smoking cessation. This is probably the most common discussion you will ever have when you start working in NHS. What if you get a station about this? What if someone asks you in the exam, like this is a patient who's about to be discharged, and you need to talk to this patient, advice about smoking cessation? It could happen. No one knows what might happen the day of the exam, and this is all hypothetical scenario. But let's get cracking. I am a 29-year-old man who I was admitted for asthma exacerbation. I have asthma, by the way, and I'm being discharged, and now your consultant asked you to come and talk to me and convince me to stop smoking. I don't smoke, by the way, but hypothetical. All right. Stop smoking. The history. First, do you know why you're admitted in the hospital? Yes. Why? I'm admitted with asthma exacerbation. Can you tell me more in your own language? Do you know what is very bad for asthma? Is it allergies? Well, you're right. Allergy could be bad, but what else? Smoking. That's it. That's all the history you need. Hence, you start smoking. You could dive a little bit into the past medical conditions. So, like, ask, do you have any other conditions? You wanna try to pinpoint something that smoking will aggravate or will make worse. So, I was asked to come and talk to you about ways we can help you to stop smoking. Are you interested in this? Yes. Carry on. Well, you have behavioral therapy and you have medication. And studies showed that the best of all is a combination of both of them together. Okay? Now here you want to go with the patient. As always mentioned, before anything you want to safety net. Of course you know that in the first couple of days you're going to have a withdrawal symptoms. These are going to be stuff like palpitation, sweating, agitation. Usually they tend to improve on the third or fourth day of stop smoking. Then you need to also give advice, because in PLAB you're not supposed to just give medication, information. You're also expected to act as an F1, F2 level, which is advice. So please, I know you want to quit smoking. There are some things that could be trigger for craving, like stress. You need to try to stay away from stress, being around people who smokes, and being intoxicated, meaning a lot of alcohol. So please, if anyone in the house smoke, it would be reasonable to ask them to stop smoking as well. Try to meditate. Carry on in part 2 to hear the rest of the management.